Pupils returned to English schools on Tuesday after the Christmas break, and the head teacher at Richard CHALLONER school in South West London is worrying about staff absences.
I've had 4 staff email me saying they'll be in isolation at the beginning of term. Now we can manage that, but if that becomes 10 staff or 12 staff, we've got huge problems.
And not for the first time in the pandemic, English schools are implementing last-minute policy directives from the government. All high school students must now wear masks in classrooms.
I, like all the other head teachers around the country, found out about when masks in classrooms for lessons when we read the national newspapers on Sunday morning, which is appalling in my view. How is it that the press know what is going to go on in the classroom before head teachers have even been briefed on that?
But this is the only real tweak to Boris Johnson's Omicron gamble. While Scotland, Wales and Northern Ireland all brought in restrictions before Christmas, the Prime Minister chose not to for England. He's sticking with his decision.
The way forward for the country as a whole is to continue with the path that we're on.
The gamble is that vaccine coverage and Omicron's relative mildness will prevent the health service from being overwhelmed. But even Boris Johnson recognises it's not looking good.
The pressure on our NHS, on our hospitals, is going to be considerable in the course of the next couple of weeks and maybe more, because there's no question that Omicron continues to surge through the country.
Elsewhere in Europe, with the new year come new steps. France is going ahead with measures announced last week, a 3-day work-from-home rule for those who can, big public gatherings limited for 3 weeks, and Parliament is debating a change to France's health pass. Only the vaccinated would be allowed in restaurants, cafes and more. The health minister condemned alleged death threats from anti-vaccination activists.
Ne perdons pas de vue.
Let us not lose sight of the fact that the objective of this law is not to restrict individual and collective liberties of French people. The objective of this law is to save lives. It is to protect our hospitals and relieve the workload of our health workers.
Despite opposition from some politicians, the backing of several parties means the lower house will likely pass the bill. Rory, Challands, Al Jazeera.